Today we will discuss a very important topic, which is common ENT emergencies. And ENT is divided into ear, nose and throat. For now we will only be talking about ear problems which can come as an emergency, and we should not ignore them. As a participant of this lecture, we will also see why it is important to focus our ears in a very important manner, because they not only help in balance but they also help in hearing. So we will start with common ENT emergencies for ear. Ear emergencies include the pinna. The pinna is like this is the pinna, the perichondritis, auricular hematoma. EAC, external auditory canal. This canal is the external auditory canal. Here there can be foreign body, malignant otitis externa. Middle ear is just comprising of area behind the tympanic membrane and which has the ossicles and the middle ear space. So there can be trauma to the temporomandibular joint, trauma to the tympanic membrane, acute otitis media, acute mastocytitis. And in the inner ear there can be sudden sensorineural hearing loss. So these are some of the ENT emergencies that come in a very common manner. First we will talk about foreign body. When you see here, the foreign body is lodged in the tympanic membrane in the ear canal. It can be insect, cotton, paper, organic material, small batteries. They will cause discomfort and agitation, and they can cause secondary complications like infection and mucosal erosions. Foreign body that needs to be removed, and there are several instruments that are there that can be used. One is a crocodile forceps, other is a blunt hook, another is a syringe, and last is a vacuum sucker. So we have to be very vigilant which foreign body and which instrument to be used. Next is auricular hematoma. When you see auricular hematoma, there is trauma from the auricle and there is fluctuant bluish swelling in the auricle. It needs to be drained and aspiration and apply compression dressing. Traumatic TM perforation. So this is a tympanic membrane which has got hit by some blast injury or instrumentation or by some so most commonly that we see is a slap on the ear. So very careful when you try to do this, not like this on the ear, because it can cause traumatic perforation of tympanic membrane, and you need to observe the treatment. The perforation will get smaller in size. Usually it gets smaller in size, and rarely it requires surgery where tympanoplasty has to be done. Next is temporal bone fracture. So blunt hand injury, that can cause temporal bone fracture. There can be longitudinal fracture, then can be transverse fracture. Longitudinal fracture will cause facial paralysis. That means the face will become jeopardized and facial muscles will get paralyzed. Transverse fracture will cause sensorineural hearing loss and disequilibrium. There can be vertigo and disequilibrium in these patients. Temporal bone fracture, one of the sign is the battle sign. Battle sign is bluish discoloration of the post-auricular region. There will be raccoon eyes, hemotympanum, hearing loss, dizziness, CSF otorrhea and paralysis of the 7th cranial nerve. CT temporal bone will help us to diagnose temporal bone fractures. Acoustic trauma. So acoustic trauma is something which is exposed to sudden loud noise. Supposingly you are in a pub where there is a lot of loud noise, or DJ playing the music at a very high speed and loud noise, and you're hearing that can cause sudden exposure, or there is a blast injury, or this can cause acoustic trauma. Sudden sensorineural hearing loss and tinnitus is common in acoustic trauma. So we usually give for treatment corticosteroids, carbogens, vasodilators, diuretics, anticoagulants and plasma expanders. Otitic barotrauma. Otitic barotrauma is inability to ventilate the middle ear, and there is abnormal dysfunction of the eustachian tube. So this usually happens when we are going at a very high altitude or going under the sea, that is scuba diving. Then the pressure equalization between the tympanic membrane outside and the inside eustachian tube area will not be balanced, so that can cause otitic barotrauma and can cause hemotympanum. So this is the hemotympanum that can happen, blood accumulating in the middle ear. Barotrauma. So barotrauma is when once you are the same thing, the aortic trauma or the barotrauma, and be treated by myringotomy and putting a grommet insertion here. Next is sudden sensory hearing loss. This needs to be very well understood, because once usually what happens in these patients, they were sleeping and suddenly when they wake up, they see that they have lost the hearing. This is a case of sudden sensory hearing loss. So, also, sudden sensory hearing loss will be diagnosed by pure tone audiogram, or when more than 30 decibels over 3 contiguous frequencies within 3 days or less is observed. Etiology is viral and infectious, vascular, trauma, autoimmune or neurologic. Complications of middle ear infection, extracranial. It can be divided into intracranial and extracranial. Extracranial infections are rupture of the tympanic membrane, that is otitis externa, leading to otitis externa. There can be labyrinthitis, there can be mastoiditis, subperiosteal abscess over mastoid process, neck abscess, facial paralysis. These are the complications for middle ear infection, extracranial. We will talk about a very common problem that happens in children, and that is acute mastoiditis. Young children preceded by acute otitis media, there will be severe pain, fever and edema over the mastoid region, and then we have to give intravenous antibiotics, and myringotomy and grommet insertion is to be done. Subperiosteal abscess, that means this area there is abscess accumulation. There will be pinna is pushed down and out, intravenous antibiotics, IND, incision and drainage, and mastoidectomy has to be done. Complications of middle ear infections, it can be intracranial when it goes inside the brain. Once it is crossing the dura mater, it is causing cerebral abscess. It is outside the dura, but in the ear, that is extradural abscess. There can be subdural abscess. There can be meningitis. There can be thrombosis of the lateral venous sinus and cerebral abscess. So these are the common complications that can happen. So the take-home message from here is, any ear emergency should be taken into well noted and need to be corrected immediately. If you prolong take care of your ears very well. If you prolong any problems with ear, it can lead to severe complications.